Konnichiwa, Dr. Braces here. Thank you so much for tuning in. Today we're going to talk about a pretty neat topic. How does orthodontics actually work? We're going to get into the biology of braces and Invisalign. Now, to move a tooth, you have to move that tooth through bone, and that's not an easy thing to do. So if you ever have wondered, why does it take a year and a half, even 2 years to get my teeth straight? That's why, is because the tooth, in order to move, it has to move through bone. How does that process work? Okay, so with braces, you're going to put braces on your teeth. You're going to tie a wire to those braces, and that braces is actually the worker of the system, right? So the wire is going to pull the teeth into the position that you want them to go. Invisalign, in contrast, is a little bit different. When you put Invisalign on, you have a plastic there that's actually pushing on your teeth, and that's how it moves teeth. So braces, the simplest way to think about it, braces pull teeth into position, Invisalign pushes teeth into position. Now at a cellular level, how does that work? So I have a tooth, let's say my hand is the tooth, and I need the tooth to move in this direction. The problem is there's bone here, right? So this bone is preventing that tooth from moving. So what you do is you apply a force to that tooth in that direction, and that's going to create an inflammatory response. So inflammation is going to occur, and because of that inflammation, these little cells are going to come in here. These are called osteoclasts. Osteoclasts are going to come in, and they're going to start to chew and resorb that bone away. So there's no bone here now. Once that bone has been resorbed, and again, this is all a gradual process, the tooth is going to move into that position you want it to go to. Now, what's the problem here? Now there's no bone on this side of the tooth, right? So that has to fill back in. So these other cells called osteoblasts are now going to come in behind the tooth where it moved from and fill that bone back in and build that bone back up. You apply a force. The force causes pressure on the bone. Because of that pressure and inflammation, the osteoclasts come in, they chew the bone away, and then the tooth can move into that position. And then the osteoblasts come in and build the bone back up. So at the cellular level, that's kind of what's going on, is you're having bone remodeling over the course of your entire orthodontic treatment. This is a very, I should just say, a simplified explanation. But in the simplest terms, that's how you can move a tooth through bone, is because of those special cells called osteoblasts and osteoclasts. So sometimes in a case, I'll reposition a bracket. So let's say I have a tooth. I want these two teeth to be at the same height, right? But one's a little bit higher than the other one, okay? So what I'm gonna do is I'm gonna take the brace off of this one, I'm gonna move it up, right? And then when that wire comes in, it's going to come across, and at this tooth, it's gonna move up. And so that force of that wire is going to now be able to, again, braces pull, right? So that wire is going to be able to pull that tooth down into position. And that's kind of how that works. So again, the wire is, in the braces process, the wire is the thing that does all the work for us there. So if you ever have a tooth that's not lining up quite the right way, your orthodontist may take that tooth off, or not that tooth off. Hopefully they don't take the tooth out. Your orthodontist may take the brace off of that tooth, put it in a different position, and then when you go in and engage that wire into the bracket, the tooth's going to move where you want it to go. Invisalign works very similar. A lot of the times with Invisalign, the two teeth that don't cooperate are these two right here. We call those the lateral incisors. Why do we have a hard time moving those with Invisalign? It's because they're small and they're flat. And so remember, Invisalign pushes teeth, and if there's not enough of the tooth or undercuts in that tooth to grab onto, then sometimes those two teeth, for example, will fall behind.
Why must you be so constantly irksome?
So how do we fix that? You finish your first round of Invisalign, and then those two teeth need to move down a little bit. What you would do is you would take a new scan of those teeth. More than likely, you'll add a little composite attachment. So if this is a tooth, you might add a little bump on that tooth that sticks out. Now that Invisalign plastic has something extra to push on, and that's going to help move that tooth down into the position that you need it to be. And so, it's taken a lot of years, decades to get these systems figured out, and I think it's fascinating. Attachments with Invisalign, nickel titanium wires that we talked about in a previous video. All of these are advancements in orthodontics that make it go faster with less pain and more convenient and better for the patient. And that's what the ultimate goal is make this be a good experience for everyone that walks into our doors. When you first take your braces off, your orthodontist is going to give you some retainers. The reason why those are super important is because, like we talked about, that bone has to build back up. And until that happens, those teeth can always turn and move and go back to where they were. And so you have to wear those retainers initially all the time until the bone has fully remodeled. And that takes a few months. But even after that, the teeth always kind of want to move and shift and go back to where they started. And so you have to have and wear retainers. So in the next video, we're going to talk about all the different kinds of retainers that are out there, what the orthodontist might offer you, and what is going to be best for you in terms of keeping those teeth straight. I always say that the retention part of orthodontics is the most important part, because if you don't wear your retainers, you will inevitably end up not all the way back to where you started, but definitely the teeth will shift and they won't be perfect anymore. So if you're interested in retainers, click the link below. Look forward to seeing you next time. And remember, smiles change lives, so keep smiling.